Thank you very much, Doctor. So clearly you're saying these are areas that we need to be concerned about, but also areas with regard to hydraulic fracturing that we don't know enough about.
Correct.
And therefore the need for additional studies. What kinds of studies? How long would these kinds of studies take to complete? Where should we be? How should we be going about this?
Sure, it's a fantastic question, and I think it's been addressed somewhat by the two previous speakers. There are a variety of epidemiological studies that can be performed. Kind of the gold standard are your prospective longitudinal cohort studies, where you have a community. For example, you have a community before any natural gas extraction is going to occur. You start studying them beforehand, right? Because all the criticism of all the stuff that's being done right now with hydraulic fracturing is that we don't have any baseline data, right? So if you have water that's contaminated, what the industry will say and what some public health people will say is, well, you don't know exactly where that contamination came from because you don't have baseline data. So you need to start optimally in a community before there's any natural gas extraction going on. And so you get your baseline data at that point, and then you study the community in a longitudinal fashion. So you do it before any extraction occurs, during extraction, and then afterwards as well. So the unfortunate or the drawbacks from those types of studies are obvious. They're obviously quite long. So those are years. The EPA portion, the study of the EPA portion looking at water, they say their official results won't be back until 2014 in some aspects of the study. So the prospective studies are long, and they're also quite expensive to some degree.
Well, the during and after part of those studies infers that there would be drilling that would proceed, and then we would study the results of that, which is a little different than, I think, the precautionary principles that some others have talked about this morning, which would argue in favor of don't do it unless you know exactly what you're getting into first.
Sure, and I think in different parts of the country you may be able to do different types of studies, because there are certain parts of the country where this is going to proceed regardless of what public health authorities have to say, I believe. Here in New York, fortunately, we have the opportunity to perhaps use a precautionary principle and study things first and get information from a variety of sources before we proceed. But in other parts of the country, they're still doing this quite regularly. So that might be one instance where you could go into a community and start studying that before it's done and then continue to do it afterwards.
Well, do you know of any studies that you would consider to be valid scientific or medical studies that exist now that have examined these issues and produced a report, a conclusion of any sort?
Not that I know. Exactly like Dr. Law mentioned, they did the systematic literature review looking for specific papers. And what you'll find is stuff like the Osborne paper, which was fantastic. You'll find Theo Colburn's paper from the Endocrine Disruption Exchange. But none of those are looking at necessarily human health effects. So they're definitely a piece of the puzzle. They're trying to show that there is some exposure to a variety of chemicals, but the next step will obviously be to link that exposure to human health effects. And that's oftentimes the most difficult link to complete in any epidemiological study.
Well, do we need to separate out studies on children and studies on adults, or are there things that we can extrapolate from, let's say, a study of children with regard to adults or vice versa?
So I think a lot of times it is difficult to get child data for a variety of reasons. Oftentimes families are quite reluctant to have their children involved in studies, even if it is kind of an epidemiological data-driven study. And there are just not as many families that are willing to participate in studies like these. So oftentimes what is done is that you do get the adult data and then you extrapolate it down to children. The thing you have to keep in mind, though, is that children are, like I mentioned, are more susceptible to a variety of toxins. So a level of chemical X, the safe level may be lower in children than it is in adults. And so you have to take into account those fundamental differences between children and adults.
Let me ask you a question similar to what I asked someone previously, which is that in those families where there are medical conditions that the families attribute to living in close proximity to drilling, after the fact, now that these medical conditions exist, is there a way to figure out whether they are attributable to the hydrofracking that's going on, or or not?
Sure. I think theoretically it is. Like Dr. Law mentioned, it will be somewhat difficult to kind of tease out all the determinants of health. So we know that people's health are influenced by a wide variety of factors. But we have been able to show that community level studies are important. So if you look at a study looking at the Atlanta Olympics, what they did is they studied ozone layer levels, like the previous doctors mentioned, ground level ozone levels. So they studied them beforehand, during the Olympics, and then afterwards. Because what Atlanta tried to do is they tried to clean up their air, encourage people to use public transportation, not drive, that kind of stuff. And what they saw is that when the ozone levels dropped during the Atlanta Olympics, asthma admissions, asthma visits dropped as well. And so they correlated quite well. And so that's just one example of being able to do community level research without going to individual families and discussing with them. So I think it is possible, but like Dr. Law mentioned, it's going to take a bunch of epidemiologists and public health authorities get together and design these studies.
Thank you.
I don't have any questions. I just want to ask you to give my best to Dr. Landrigan, and you're very lucky to be working with him.
Will do.
He's someone we've relied on for advice and support on many, many issues.
Please, I just want to echo